All right, good afternoon, everybody. Happy post-July 4th. I hope you had a relaxing time with friends and family. Here with Josh and Paul. Just wanted to give you an update. It's been a few days in terms of the COVID update, first of all. As you can see from the chart here, this is the numbers since Friday, so it's a 3-day aggregate. And what you got to know is the numbers continue to trend in the right direction, which is not true of 38 other states around the country. So we should be thankful for that. I think what's interesting is we've had 259 positive cases over 3 days. I would say that probably Arizona had 10 times that number of cases test positive in 1 day. Florida had 30 or 40 times that number test positive over the course of 1 day. Hospitalizations down dramatically over 3 days as well. That number cannot go down indefinitely, but that's a good trend. And tests performed, you'll see it's about 8,000 a day, 56,000 or so for the week on a weekly basis. You can sort of see where the trends are there. And that's a pretty good number given the fact we have so many fewer people who feel symptomatic, so they're a little less likely to get tested. But we are seeing around the rest of the country, people are lining up to get tested again as they see their infection rates pick up. So I think this is a good time for people to take advantage of our capacity. The testing overview, I think this is something you've seen many times before, and the good news is the moving averages are down below 1%. We are down, I think it's 0.7%, less than 1% of everybody tested positive. That's over the last 7 days. That's better than any state except for Vermont, is my understanding, and thank you for taking the protocol seriously. When you have so many fewer people testing positive, means that we're able to really stay on top of contact tracing. That said, we're ready if there were some sort of a surge as well. We've got, this is per Josh, we've got 100% of our local health departments are now engaged, uploading information to the cloud, making the calls on a regular basis. 885 people signed up to do contact tracing. 120 of them are volunteers. Most are from our local health departments. Some are from our state health department to provide support to the locals. We're now responding to 96% of all those cases we reach out to within 48 hours. So I think that's really good. But less than half of them are successfully contacted. Maybe if there was a party, maybe there's some sort of an event, maybe you just don't want people to know. And our job and the contact tracing people, why we call, why we don't just do it electronically, is to tell you if you care about your friends, you care about your family, let us know so we can keep them safe. And if you get a text that reads CT COVID trace, respond. The next, just want to give you a brief update on what's going on around the rest of the country. This is from the Houston Chronicle. I mentioned last week that their notice to people for July 4th weekend was stay home. I think this is yesterday where they said, what happened? How did we get here? They had such a low positivity rate. And let's not get too big for our britches. They had a very low rate just 3 months ago in Connecticut and New York. And in New Jersey were, represented well over half or 40% of all the positivity. Now those shoes are on the other foot. But I wanted to say one more thing about why we are going to pause phase 3. At this point, I look at Arizona, I look at Florida, in this case, I look at Texas, and we're sort of reverting to the mean, as Josh would say, by which I mean that 1 second on that, Max. By which I mean we never opened up our bars, and now they are slowly they're going back and not opening, they're closing down their bars. And you saw, as Governor Greg Abbott said, I regret having opened the bars at all because they are so conducive to the infection. And I think that was a good thing we did. Otherwise, We never opened our restaurants to more than 50% capacity. That's what these other states are going to be doing now as well. They were at 75% or more before. We had said maybe we consider larger gatherings for outside. I think let's take a pause on that. Let's keep the 25 people inside. Hopefully it's a group of people that you know and feel comfortable with, and 100 people outside where it's much easier to social distance. If we learned one thing, it's how much safer outdoors is than indoors. We had talked a little bit about perhaps raising the capacity for lots of different entertainment venues and gyms and restaurants beyond 50%. We're going to keep that at 50% for the foreseeable future. We're just erring on the side of caution, as we've said before. We see what's going on in other states, and I think it's really important that we maintain that. The next chart just gives you an idea of this is what happened in Fort Myers. And we can have a lot of guidance, we can have a lot of protocols, but they only work if people follow our guidance. As you know, we said early on, 15 feet between blankets on a beach. It's not working in other parts of the country. It's not working in other parts of the country where people, took their eye off the ball and relaxed their guard. This is Fort Myers just 2 days ago. And let me contrast that with Hammonasset Beach. This is Hammonasset Beach right here in Madison, Connecticut, where I think we cap the number of people that can be at the beach. Social distancing is easier, and that's keeping us safe. That's keeping our metrics headed in the right direction. And as you look around the rest of the country, you see a big majority of states ramping up. You see that we had 3 of the worst days for infections since July 1, since the start of the pandemic. 3 of the 6 worst days have been in July alone. It tells you that we have a lot of work to do, and thankfully Connecticut's doing it in a very thoughtful way. With that, Paul and Josh are here to answer any questions, and so am I.
NBC Connecticut.
Good afternoon, Governor. Regarding July 8th for state campgrounds, is that still a go, or is that on pause now?
That's still a go.
And you said, I just want to be clear on this, you said that you're not going to expand capacity for outdoor venues. You were keeping it at 50%. I thought it was 25%, and that 50% was going to be for phase 3. Am I incorrect in that?
Depends on the location.
Yeah, the 25% limit for large outdoor facilities that have a fire code associated with them, for example, racetracks, are going to stay at 25%.
Got it. And what needs to happen? What metric does the state need to meet for bars to reopen and for other phase 3 plans to happen? Because I imagine that a lot of bars, they're saying, look, Connecticut's been doing the right thing. We open very slowly. We're taking the right precautions. We should be allowed to open.
I think I'm taking a lot of guidance from our neighboring states, not just our neighboring states, but states around the country. I've had occasion to talk to some of the other governors as well, and they've been pretty blunt and I think gracious in saying, look, maybe we should have done this a different way, because standing up bar at the bar is not a good way to socially distance. They were not able to control it. Texas opened up. They had to close down, dozens of bars before they closed them all down because it was very, very difficult to enforce. So I think we're going to be cautious on this one.
Are there any indications on when they would reopen? Would we have to wait for a vaccine?
Let's wait and see. We'll be looking around the rest of the country. We'll be looking at our neighboring states to see if we reach a point where we think we can do it safely. Look, I like a beer at the bar as much as the next person. I know how frustrating this can be, but right now, with this pandemic flaring up in a majority of other states, this is not the time to take a risk.
Thank you.
Channel 3 Eyewitness News.
Yes, Governor, on Thursday, you said that your biggest concern for the weekend was people coming in from highly infected states. Do you have a sense of how that went this weekend?
I think we're going to get another set of numbers tomorrow, but I did talk to a number of the airlines. This is the end of last week, where I can tell you that maybe 50% increase or double the number of cancellations that they had anticipated. A number of flights have been canceled, so there are many fewer people coming from Florida, Arizona, South Carolina, now even California, than there were before. Max has pointed out to me that we did do advertising on social media in Florida, Arizona, and Texas. We've had over 1 million impressions on that. So I think people know that this region, not just Connecticut, is being very strict on the quarantining, and it's discouraging a lot of out-of-state visitation from those states.
So when it comes to that quarantine, are there any plans on increasing the enforcement beyond just the request to voluntarily do it?
We will if we have to, but I don't think so at this point. I like the fact that people are self-quarantining by perhaps not coming. That was number one. Number two, we've certainly been clear, and I think people have gotten the message, this is what the rules are. All the advertising at Bradley Airport, not to mention Kennedy and LaGuardia, where people actually have to sign a form when they land, saying what their plans are for quarantining. So far, so good, I think.
News 8.
Good afternoon, everyone. Governor, you've answered a couple of my questions, but I do want to ask you two things. You talked about in other areas bars opening and now having to close. Do you think one of the maybe other things that has happened that has gone wrong elsewhere was people being kind of lax in enforcing the restrictions? And then secondly, based on everything and hitting the pause button here, will you also try and expedite COVID testing at Bradley?
Well, first of all, when it comes to enforcement, I think I mentioned that Texas had shut down dozens of bars before they had to go back and say all bars are going to be closed. I think you remember us saying probably a month or so ago, we're trying to be cautious because we don't want to have to backtrack. We don't want to open something and have to close it. So I think that's still going to be what we want to do. In terms of testing, as you know, we've said, look, folks, before you get on the airplane in Miami, get a test 72 hours in advance. I don't know of any plans to do anything at Bradley at this point, Josh.
No, I don't think there's a single airport in the country that's doing testing at the airport. We have 135 testing sites in Connecticut, so anyone who needs a test can, it doesn't have to travel far to get one. I would add to the governor's comments, though, we have stepped up with the airlines. We now have each airline reading our PSA to all passengers.
The Associated Press.
Good afternoon, everyone. Governor, will there be state funding available to support the social distancing requirements for reopening schools, such as PPE and the barriers that will have to be put up and stepped up cleaning?
The answer is yes, Sue. We've got, I believe it's over $100 million has been distributed to the schools already out of, these are federal funds. And now Melissa McCaw, OPM, is taking a look at what the needs of our schools are going to be. That's why last week we gave each and every one of the schools and the superintendents what our protocols were in terms of social distancing, in terms of cohorting, in terms of cleaning, in terms of plastic sheaths. They are going to come back to us, give us their best idea of how to implement it and what they think that might cost. And I'll be able to get back to you. I think it's about 2 or 3 weeks that we'll have all that information and see whether we can afford to support all this. But they will be getting state support to make this happen.
And sort of along those lines, too, September can be really hot. And I'm told most classrooms have maybe one fan, and the guidelines say teachers can't use the fans to circulate air, only to blow it out. With kids wearing masks, how is this going to work? And then how do you encourage kids, especially little ones, I guess, to keep their masks on? It just seems like a pretty tough challenge.
It is. Well, one thing I'll tell you is talking to a number of the other states, they're saying for those warm days, maybe some of those classes can take place outdoors. And perhaps that's a chance to take your mask off to give you a little bit of a break. That doesn't work as well in November, but it might work pretty well in September. And there'll be other chances over the course of the day to take a break when you're outside as well. So it's not like you're going to have a mask on for 6 straight hours.
And I just had a quick question on the contact tracing. If you hear about, say, a person that's infected in a place of business, whose responsibility is it to contact authorities?
Well, I'll start with that. I mean, Josh and I were just talking about this. If it's at a university, if it's in a classroom, if it's at a place of business, if it's at a manufacturing site, obviously everybody there located has an incentive to make sure that person who's infected is immediately quarantined and do the contact tracing. I'd like to see those entities take the lead on doing it themselves, since they are local and they're in the best position to do it. Otherwise, we're there with our contact tracing people to back them up and make sure it happens.
Yeah, and as the governor said, you know, our local health departments and local health districts are the front lines for contact tracing. They know their communities best. They know the people. They know the restaurants and the other facilities. So they are on the front lines leading the contact tracing effort, and we really want to thank them. I mean, they've been working incredibly hard. Learning a new process and a new system in the midst of a pandemic is no easy task, but we now have 100% of the local health departments on the contact system, which gives us a huge advantage as a state to be able to pass contacts across jurisdictional lines to get insight at a statewide level of where hotspots or outbreaks might occur. So they've done a great job, and in that type of case you just described, they would be on the front lines helping to investigate that.
But how would they hear about it?
Well, it needs to be reported, right? Either through the facility itself or through the contact tracing investigation, right? You get the positive case. You talk to that person, you interview them, you find out where they had been, who they might have been in contact with, and you follow the leads from there.
Okay, thank you very much.
The Day of New London.
I just wondered now if, given what the case numbers are, whether we're at the point where we can say definitively that in the wake of the Black Lives Matter protests and the first couple of phases of reopening and whatnot, we were worried about seeing it. I wonder now if, given what the case numbers are, whether we're at the point where we can say definitively that in the wake of the Black Lives Matter protests and the first couple of phases of reopening and whatnot, we were worried about seeing a spike. Have we not seen that spike? Can we say that yet?
Well, it's always too early in the COVID crisis, but I would say that we've not seen a spike, and I haven't heard from other governors they've seen necessarily a spike from the nature of those outdoor rallies. And I think the fact that it's outdoors, the fact that a lot of people were wearing the mask has made a big difference. Does not mean anybody's out of the woods, but I think there's a much greater risk of what happens indoors.
Right. Thank you.
The Waterbury Republican American.
No, thanks. Sorry about that. Governor, can you give us an idea when you might be making any decision on moving to the third reopening phase or a new version of it?
Well, we usually change phases every month or so, and we usually try and give Paul notice at least a couple of weeks in advance. So I think that would still be more or less our time frame. But as Josh reminds me, our metrics are not, I'm not sure what we're going to learn dramatically different in 2 weeks that we don't know today, but that's generally been what our schedule has been.
And if you're only getting 50% or less than 50% response to contact tracing inquiries, how much confidence should people have in the contact tracing system? I mean, its purpose.
Well, I'll start. I mean, it's certainly it's 50% better than zero. We have been able to head off. You know, I understand there was one person we found that had been in contact with 13 people. So you know, we hopefully saved a lot of potential infections there. That's why we are still focusing as part of the smaller groups, 25, 100 outside maximum. That's why it's really important. It allows us to maximize. But your point is well taken. If we could get 100% of the people to take our call, take our text, we would be in a much better position to contain this virus.
Yeah, and I'd also just point out, we've been benchmarking, those metrics against other jurisdictions that share data. There's actually very few that do share data like we're sharing. We've been trying to be very transparent about all of our COVID data throughout this. But we looked at New York City as an example, who's been doing this for a while, Massachusetts, and that ratio of about half of the cases that you're able to contact actually responding and participating in the interview seems to be very consistent. So we're working together, we're trying to collaborate on process improvement, other things we can do, but the most important thing just for everyone out there is if you see that CT COVID trace come up, or you get a phone call from your local health district or the state, please take that call. It's how we can all do the small things that help keep our numbers in a good position and help us keep Connecticut open.
And the appropriate, excuse me, someone else? No? Anyway, the Appropriations Committee today had heard from the Judicial Department, and the Chief Court Administrator was a little concerned. Apparently, they've requested $4.3 million in coronavirus emergency funding. Only been allotted $1.2 million to date. He's also sort of surprised, taken aback that apparently there was a pool of $5.8 million, and out of 12 or 13 departments that sought funding, only the judicial branch was denied a request for, I believe, about $218,000 for a call center.
I got some of that. It was as regards the COVID relief fund money and the judicial branch. I can tell you that Melissa and I have not yet allocated the $1.4 billion. We've made some preliminary allocations. We got from municipalities what they're going to need. We're hearing from the schools what they're going to need. We'll be working very closely with judicial as well to make sure that we can stretch that money and they're able to open safely.
Okay, thank you.
The CT Mirror.
Good afternoon. When it comes to the people you've been unable to contact, is that just people not answering the phone, or does that also reflect people when reached who have been uncooperative?
Mostly the former, Paz, but a little bit of the latter as well.
So what happened then? In some other states, on cases where there have been concerns about super spreaders, there have been subpoenas issued or at least threatened. What's the second step in Connecticut that happens? You get an uncooperative person.
You're cutting out a little bit there, but I think the answer is that, again, the local health departments, will be using their judgment, right, to understand if additional actions are required, if there is potential for a significant spreading event that requires participation. There are tools available.
That phone seems unclear. So can you give any examples, though, of more exhaustive efforts to follow up on these?
Not yet. Unfortunately, we haven't had the need yet, but it's something we'll be watching very carefully as we've seen occur in other states, and we'll take action as needed.
Okay, thank you. And then one last question. When it comes to the self-quarantine order at the airport, is really the goal to deliver the message that unless you're coming up here, you're going to be here for longer than 2 weeks after self-quarantine, that the message is really don't come?
That's a good start. I mean, if it's absolutely essential, you've got to be here. We've got some ways to take care of that. But if you don't actually have to be here, you can do it via Zoom. You're coming up from Miami where they got a 40+% positivity rate. Stay home, absolutely.
Thank you, gentlemen.
Hearst, Connecticut Media.
It's Caitlin. How will this affect graduations? If I remember correctly, those were going to start this month.
Yeah, we allowed graduations as of today, I think, up to 150 people. And Paul or Josh, do you know of any high schools that are taking advantage of that?
Offhand, we know many graduations occurred before the change of that number guideline, but we did put out the number guideline well early enough so those high schools who haven't had graduations, who are going to hold them in July, will be able to plan accordingly. Worked very much in accordance with Commissioner Cardona, Department of Education, State Board of Ed, as well as the superintendents of those relative school districts. But yeah, no, like I said, as the governor stated, that number starts today, but that guidance was provided almost a month ago.
Okay, so even though you're keeping the outdoor event limit at 100, graduations are okay to proceed at 150?
Yes.
Yeah, that's right. As Paul said, we announced that a month ago just so high schools could plan accordingly, so that's not going to change.
Okay, great. The delay on reopening phase 3, one of the sectors that's really hit hard by this, obviously, is the arts and entertainment industry, with lots of venues. Lots of people work in that field, in audio and set design, and everything behind the scenes. And a lot of those have already said they won't open until 2021 or later, regardless. Is there any thought being given to any sort of aid to venues and things like that to ensure that they survive this?
Yeah, we haven't gone there yet, but they are eligible for PPP loans and perhaps some other grants as well. I did see that Broadway is not going to open in 2020, and we thought about some of those indoor entertainment or plays and theaters, and even opening at 25% or even 50%, it didn't work for them. They've got to fill the facility or get close to it in order to be able to break even. So it's just not the right time to open them right now.
And a question I think might be for Josh. Last week there was a study from Yale that showed that nationally the number of all-cause deaths was 28% higher than the official COVID tally. So it kind of indicates that there were a lot of deaths not classified as COVID that probably were. Connecticut was not included in that study because there was a delay in reporting to the National Center for Health Statistics. I'm wondering if you know why that delay exists, and if you could offer any insight into how many deaths you estimate in Connecticut might be COVID that aren't recorded as COVID.
Yeah, no, it's a great question. You were breaking up a little bit there, but we've released in the past, last couple of months, I think the Office of the Chief Medical Examiner, Dr. Gills, released the death statistics and compared them this year versus prior year and showed that in Connecticut, the vast majority, I think it was about 90% or more of the incremental deaths from year to year were directly tied to COVID. There was some excess. That the hypothesis is there could be some COVID-related deaths that aren't being captured, and then some others where people might be putting off critical procedures or had been that could contribute as well. I have read with interest a number of other states, Florida and others, where they want to talk about COVID deaths being low, and yet they have these amazing spikes in pneumonia-related deaths, which seem rather suspicious. But Connecticut's been very transparent in our reporting around this from the day one. I think we were one of, if not the first state to start it, including suspected COVID deaths and cases in our statistics.
Thank you.
The Hartford Courant.
Hi, Governor. We're still hearing from people who are having trouble with the Department of Labor getting their unemployment concerns addressed, having emails go unanswered, things like that. What can you say about why that is still happening and what can be done to streamline that?
My understanding, the outstanding DOL issues, Department of Labor issues related to those that there's a problem with how they were filed, maybe they were duplicate, maybe the wrong Social Security, but still no excuse. This has gone on for too long, and these are folks in real need. I can tell you that the Department of Labor, within the next week, 10 days, is going to have their call service center ramping up, hire dozens of new people to help answer those questions right now. Don't all call them on the same day, but I think we'll be making real progress there, and we have to make real progress there.
Mm-hmm. And then another thing, I think it was early April when we first started talking and noticing about discrepancies, disparities in Black people, white people, Latino people who was getting COVID-19 and who was dying from it. but the discrepancies really are still there and are maybe even worse when you look at the numbers. So why do you think that the state has been unable to address that situation and reduce those discrepancies as the pandemic has gone on?
Yeah, that's a great question. I'll start then, maybe give me some help. But again, black and brown people are disproportionately impacted by COVID. 2 to 3 times more likely to suffer complications. When it comes to African Americans, twice as likely to suffer a fatality. There are a variety of reasons for that. One may be pre-existing conditions, also a little less likely to be able to telecommute like some of the office workers. If you're a frontline worker, showing up every day to work and putting yourself at some risk, real heroes, I got to tell you, food service workers, nurses, and the such. And finally, more likely to live in congested areas where it's not as easy to socially distance, not as easy to quarantine. And that's reasons number 1, 2, and 3 that we really focus like a laser beam on these communities, not just saying come in and get a test, it's free, there's no cost, no questions asked. We can pay for treatment as well. We're taking the testing right to those communities to make sure we can catch it earlier and make sure that they and their families and their community are safe. Anything to add on that?
No, I think, Governor, you hit it perfectly. Like I said, these are many issues that have affect these communities disproportionately for generations. And one of the things that the governor has tasked myself, Josh, and the rest of our team to do is to get right down there and make change, and the governor spoke to it directly. We were one of the first states to have a CVS rapid testing site. We partner with community health centers, so the testing is happening directly in their communities. We increased our outreach and our communications to those communities to let them know that if they have symptoms, you need to act upon it. We have increased our PSA campaigns, including one that we have launched this past week about testing, particularly for communities of color. This is, like I said, these are generational problems, but we're trying to make generational change right away.
Is there more that you could have done to kind of reduce these disparities, or more that you can do as we look ahead to a potential second wave in the fall?
I think one of the things that we are doing is to increase the overall education within those communities that are affected, so people know directly and understand what COVID-19 is and what it can be to them and to their families directly. I think one of the things that early on within these communities, many communities of color, was, as you know, there were many people who are saying that this disease, this epidemic doesn't affect people of color. That was one of the first earlier things that was said in March, and the numbers showed differently. And one of the things that this state has done under the leadership of this governor is to go right down into the communities and start making directional change right away. That's why testing is extremely important. That's why you see our numbers are showing what they are. The numbers that we have and the impacts that it's had is a direct showing of the work that has been done by this amazing team since the epidemic hit our state.
All right, thank you.
Fox 61.
Hi, good evening. This is Aisha from Fox 61. Just for clarification reasons, I understand the big emphasis right now is on bars. Is there a scenario where the state will move forward with increasing capacities for other businesses without bars?
Yeah, that's certainly a possibility. Right now, we wanted to keep it simple. We're pushing off phase 3, and that includes the capacity issues beyond bars, as we said before. But as we look at the metrics, look what's going on in other states, absolutely. We can slice and dice this in a way that keeps people safe, yet allows them to get back to some sense of normalcy.
Thank you.
WTIC 1080 News.
Leading up to the restaurant reopening, we heard a lot about the Restaurant Association and their thinking. Are you hearing a lot from the bars, and are any of the bars looking to potentially move outside if that was possible?
Right now, that's not under consideration for us. It's just not activity that's really oriented towards social distancing, indoors or outdoors. But we can always relook at that in the future.
And are you getting complaints from that group? A lot of them might go under.
Well, I know Greg Abbott got sued many times over by bar owners, and people aren't afraid to act accordingly in this state as well. But so far, I think people are generally understanding of what we're doing, why we're doing it reluctantly.
Also, I was hoping to ask a little bit about the national calls you've had with Pence's group and all the governors. Clearly, you and Cuomo, and on the Republican side, Hogan and DeWine have had some success with the masks and the social distancing. Doesn't it come up that, here's what's working, and did you get any other response from the states that were so slow to react on why?
I would say there was a bit of a divide amongst the different states in terms of are you going to require people wearing the masks and how strict they were about the distancing and how fast they opened. I'd say that divide has shrunk quite a bit in the last few weeks. And hats off to some of those governors, mainly in the South, that had to rethink what their strategy was because they're faced with reality. And so I think you see the governors really speaking with one voice and all wearing the mask.
Connecticut Public Media.
Good afternoon. July 4th celebrations, are you concerned that this might cause a spike? I know you referenced that picture at Hamanas, and it looked like things were going well, but the South certainly saw spikes after Memorial Day. And if so, when would we notice these spikes since there is more testing? Would it still be around 2 weeks, or do you think we would see an increase in cases sooner?
I think it usually takes, 2 to 4 weeks. But look, we've been through Memorial Day. We've been through protests. We've seen a number of big outdoor activities, which frankly I was worried about. I thought you could see a spike here. And so I'm confident that, I'm not confident of anything in COVID, but we've gone through a July 4th. You've seen Hamanas. I think you've seen how Connecticut, sort of reacts responsibly in a situation like this, and I'm feeling good that we're going to be able to keep going.
CT News Junkie.
Thanks, Max. I think this question might be for Josh. Josh, I'm starting to hear complaints from nursing homes that the PPE they're getting from the state is not adequate. Like the gloves are not, they're food quality, not medical quality. Masks are not clinical use. And they're afraid to use this material because they could get dinged in an infection.
Okay, well, that's the first I've heard that concern, but if a specific home has a concern, they should absolutely escalate it through the mutual aid process, and we'll see what we can do to help, as we have been helping throughout this pandemic where we can, and helping with the testing now, which has ramped up considerably in the nursing homes quite successfully. So whatever we can do to help, that's what we're here for.
And the nursing homes are being tested on a weekly basis along with all the staff?
That's correct. So that program has ramped up well. The state is supporting that financially in the short term here to ensure that it happens. And we're actually pleased to note that as of last week, over half of the nursing homes in the state have tested for 14 days with no positive cases of either staff or residents. So we're making good progress there.
Okay. Thank you.
You're welcome.
All right, everybody, I think that's a wrap. I just wanted to say one thing. You saw last week we have started some public service announcements. We're trying to remind people the importance of wearing the mask. And the contest last week, my lousy imitation of Frederick Mercury was crushed by Gino Oriama's Wear the Mask PSA. Today, I just wanted to give a special shout out to the folks who are managing our beaches. They're everything from DEEP to the lifeguards. They've been on the front lines. You saw the picture of Hamanas. They're taking it seriously. And here's a friend of ours, one of the lifeguards, reminding people to wear the mask.
People always ask me, do I need to wear a mask on the beach? If we want beaches to stay open, we have to work together. So have a mask with you and keep a safe distance from others. My whistle is just as loud with my mask on. I see you.
Thank you, everybody. Wear the mask, Josh. Take care.